Today we are going to discuss about a product which was introduced. Maybe some of you weren't even born then. This product was introduced way back in 1989. I was working for a very small company, but someone who had the managing director who had a vision for the future, and that company was Sun Pharma. Sun Pharma at that time was exclusively in the super specialty segments of cardiology, neurology, psychiatry, and gastroenterology. We never met any general practitioners. Sun Pharma is even today a specialty oriented, CP oriented and above company. A big challenge came to us when we were introducing an antidepressant. Are you aware of what is the difference between an antidepressant and anxiolytic? Anyone? You can raise your hands and answer. What is the difference between an anxiolytic and antidepressant? Anyone can raise your hand and answer this question.
Sir, anxiolytic is the having decreasing the anxiety, and antidepressant is it reduces depression.
Yeah, you're almost on the right path. Can you add something to what you have said right now?
Uh,
You're
uh,
right. What you have said is totally right. But I'm asking whether you can add something to what you have said.
uh,
Anyone can try?
Hello, sir.
right, more anxiety leads to depression.
Sir, in anxiolytic, it's depress the fear
Okay. Okay.
and
Exactly what is the
antidepressant.
difference between an anxiolytic and antidepressant? Suppose you have been called for a promotion tomorrow. Okay. You have been doing very well as a brand manager and you have been, say, called for an interview for the position of a marketing manager. Before you go for the interview, you will have a little bit of nervousness, maybe a little bit of sweating. That is what is anxiety. Remember, what is the event? You're facing an interview for the position of marketing manager. So, anxiety is something, which comes before an event. Anxiety is something which comes before an event. Little bit of nervousness, that is perfectly okay. And the psychologists say that a little bit of anxiety is always a good motivator. A little bit of anxiety is always a good motivator. In fact, in the coming days, where we are going to host the World Pharma Brand Managers Day, the week, the culminating day on 20th, is giving me a lot of anxiety. But that anxiety is making me more and more, gives me more energy. Now, you face the interview for a marketing manager, you get through and you're very happy. But what happens if someone doesn't get selected? When you don't get selected, then you go into a stage of depression. Then you go into a stage of depression. Or in other words, anxiety comes before an event, and depression comes after an event. And you'll be surprised to know that even in those days, apart from the psychiatrists and the neurologists, the other doctors, They did not know what is anxiety, what is depression, and what is the difference between anxiety and depression. Am I clear? Even in those days, even the doctors were not aware of the nuances between antidepressant, sorry, between depression and anxiety. Now, in this melee, we had to introduce a product. It was fluoxetine. Fluoxetine was the first SSRI to be introduced. Prior to the introduction of this antidepressant SSRIs, we had what we call as tricyclic antidepressants, TCAs, tricyclic antidepressant, amitriptyline, nortriptyline, trimipramine, and so on. All these were considered to be very good antidepressants. All these were considered to be very good antidepressants. But all these classical tricyclic antidepressants, they had one problem. And what was that problem? It caused immense sleepiness. It caused immense drowsiness. And the doctors had to recommend that dose only at bedtime. But the dose actually in the textbooks and in the PDR, physician's desk reference, one tablet 2 to 3 times a day. One tablet 2 to 3 times a day. So what happened? If somebody took the dose in the morning or in the afternoon, they felt drowsy, they felt sleepy, they could not do their normal work. Otherwise, a very, very good antidepressant. And that is why in those days, in cases of severe depression, people used to get ECT. What is ECT? ECT is electroconvulsive therapy. Electric shock, as we call it in common words. Electric shock. And electric shock or ECT was the remedy for depression. Now, depression, which even the doctors of those days did not know, was a very, very tricky thing to diagnose. You know why it was a tricky thing to diagnose? First of all, in very severe depression, patients used to have suicidal tendency. Patients used to have suicidal tendency. They felt that I am worthless, I am of no use to the world, I am of no use to this family, why should I live? And suicidal tendency was not only very high, but many people, they committed suicide. Even today, when you read the newspapers, one of the reasons for suicide is because of depression. And do you know, one of the most beautiful actresses of our times, she had major depressive disorders. Do you know who's that? Anyone?
Deepika Padukone.
Absolutely. Who said that?
Sir Shubham Selokar.
Wow, wow, wow. So you're keeping yourself abreast of what's happening in the industry. Very good. She was the
Thank you, sir.
one who had depression. She overcame that depression, and today she's running a campaign for the patients on what to do if you're in a stage of depression. So anxiety can lead to, depression can lead to suicide. Now again, depression was something which was very, very funny. Funny for those who, but very disturbing for those who are actually depressed patients. Why do I say it funny? Some of the depressed people, they could not get sleep. Some of the depressed people, they spent sleepless nights. And some other depressed patients, they slept for a long time, maybe 10 o'clock, 11 o'clock in the morning. But the problem, even after 10 or 12 hours of sleep, when they woke up at 10 o'clock or 11 o'clock, they did not feel fresh. So depression could lead to either loss of sleep or prolonged sleep. Appetite. For some people, depression led to total loss of appetite. For some people, overate. Depressed people overate. It was also called as binge eating, BINGE, binge eating. So binge eating was very common, is very common in patients with depression. So some people had no depression, no appetite. Some people felt very hungry. And therefore, in many of the depressed patients, they were overweight. Some
Sir,
people used,
excuse me. Sorry to, sir, are you sharing the PPT also?
yeah, I'm sharing it a little later. I'm
Acha,
sharing
you
it.
will share. Right now, you're not sharing any PPT,
No,
right?
right now I'm
Okay,
not.
okay, okay. ठीक,
Yeah,
ठीक.
no. Okay. So, uh, some people overeat, some people don't have appetite at all. Some people don't have an appetite at all. That is why I called it funny. Then another common disorder with patients with depression is what you call as OCD, obsessive compulsive disorders. Like patient with OCD, he always felt that he is unclean. And every half an hour he goes to the wash basin to wash his hands. He may have a bath 5 to 6 times in a day and still, I'm not clean. I'm obsessed with dirt. That is another symptom of depression. So these are some of the common symptoms of depression. When fluoxetine was introduced into the tricyclic antidepressants which were ruling the market. Imipramine, trimipramine, and then there was another called as prothiodyne. Prothiodyne was then from Boots. That was also tricyclic antidepressant. Can everybody be on mute? Yeah. So this is what happens with tricyclic antidepressants. They all cause sleep. There was another problem with these tricyclic antidepressants. And what was that problem with the tricyclic depressants? They had an effect on the heart. It affected the rhythm and could cause cardiac problems. Therefore, in patients with cardiac problems, tricyclic antidepressants were never prescribed. Tricyclic antidepressants had another very big side effect, that is dryness of the mouth. It was an anticholinergic. All the tricyclic antidepressants are anticholinergics. They produced dryness of the mouth, blurring of the vision, and therefore many of the non-psychiatrists and neurologists, apart from these two doctors, other doctors, they were neither aware, neither they touched tricyclic antidepressants. So when fluoxetine was introduced in India, Sun Pharma at that time was just a fledgling company. There were other giants which introduced fluoxetine, and one of them was Cadila, the other was Torrent, and Cadila under the name Fludac, Torrent, I don't recall the name. And then there was one more company called Copran. Copran doesn't exist anymore, but that time it was a very big company. Copran was another company which introduced, and that was a big company at that time. Sun Pharma was just a baby, a fledgling. So when this fluoxetine was introduced by these three giants, what did these doctors do? Or what did these companies do? They straight away went to the psychiatrists and the neurologists and introduced their brands. And there was a bloody red ocean in the psychiatrist chamber, one against another, one against another. Psychiatrists first flooded, but not the other categories of the doctors like the CPs or gastroenterologists or the cardiologists. We wanted to be different. And I wondered, I was the brand manager then, I was handling the brand. The name was Prodep. I was handling Prodep. And we wanted to be different. But how can we be different? Me and the medical team thought a lot about it. And then one day, I was on a flight to Bangalore from Baroda. Sun Farm at that time was located in Baroda. And seated next to me was a very elderly gentleman. We got introduced to each other. I introduced them from this and this company. I'm from the pharma industry. Oh, you're from the pharma industry. And he introduced himself as a Vaidya, a leading Vaidya treating patients with Ayurvedic medicine. And he told me one thing. One drawback about allopathic drugs or pharmaceutical industry products, the modern pharma products, they treat only the disease. They don't treat the mind. If the patient has to get really well, first his mind has to be treated and then the disease. I took that statement very seriously. When I returned to Baroda, I had a meeting with my medical team. And the medical team, they all said, yes, patients with cardiac problems, patients with hypertension, they all have associated depression. And this was documented in magazines like New England Journal of Medicine. Then it was documented even in some of the leading journals of USA, even in the British Medical Journal. That gave me a thought. Cardiologists, gastroenterologists, they have not been touched by any of these competitors. And that slot was vacant. That entire slot was vacant. But the problem, neither the gastroenterologists, nor the cardiologists, nor the consulting physicians, nor the diabetologists, they knew what was depression. The medical team suggested, okay, we can have CMAs. But CMAs would have taken a long time across the country, and no cardiologists were ready to listen to a psychiatrist speaking or a neurologist speaking. So it was left to us to promote it only through our field staff. that is of medical representatives. But promoting a disease through a medical representative, that was a challenging task. How could we do that? How could we promote a disease to a non-psychiatrist, promote depression to a non-psychiatrist? And depression was a very, very serious subject. The entire medical team and the brand management team, we were thinking what to do. And suddenly somebody came with the idea. Why not have caricatures to educate the doctors for our medical representatives? If you tell the medical representative, go and talk to the doctor about what an antidepressant is, neither the medical representative will be able to verbalize correctly, nor will the doctor like to listen from a medical representative what depression is. So we were thinking what to do, and suddenly this young doctor, probably many of you may be knowing him today, he is a renowned rheumatologist in Bombay, Dr. Nimish Nanavati. He suggested, he was then the medical advisor for Sun Pharma, and he suggested, why not educate through cardiology, through caricatures? But whom to approach for drawing those caricatures? I spoke to our advertising agency, the design agency, Kishore. I asked him to find out a good caricaturist from Bombay. And then he got hold of Vasant Harbe. Have you heard about Vasant Harbe any time? Of course, all of you are very young to hear his name. He was a well-known caricaturist, and he used to draw caricatures in children's magazines called Twinkle and other Amar Chitra Katha magazines. His name was Vasant Harbe, very renowned caricaturist of those days. Unfortunately, he's no more living in this world. We approached him and told him our problem. Can you explain through caricatures what depression is? Now, for Vasant Harbe to understand what depression is, it took me almost 3 hours. Fortunately, I could communicate in Marathi, he could understand me, and then, okay, he said, come to me after 3 days of 4 days. I'll give you something. I had to tell him what depression is, what are the various facets of depression. Some people feel hungry, some don't eat at all, some sleep, some other don't get sleep at all, and so on. So we decided we'll promote this product through caricatures. And at that time, promoting through caricatures to consulting doctors, it was a little odd because everybody was talking about medicine, a very heavy subject. We decided to make it light. Now, I'd like to show you what was that visual aid which we designed in 1989. But remember, in 1989, when the designers, they designed visual aids, computer was not available. It had to be done through physical typesetting. They had to go to your typesetting, get it done. It was a tedious task. So remember, the visuals which you're going to see now probably may not be technically as beautiful as they are today because of the limitations of those days. So I'd like to share my slide and show you a few caricatures on how we promoted product and made it a brand leader. Do you have a sense of humor? And remember, my friends, every doctor would like to smile. Every doctor would like to smile because a doctor is first a human being and then a doctor. This is a small beginning. You got a virus from your computer, and we thought you and we had to erase your brain. I hope you got a backup copy of that. Coming back, let us see what that product was. As I told you, depression had various facets. Some people, they could not get sleep. And see this man in the form of a caricature trying to get sleep. See the expression on his face. And this person, he oversleeps. But even after oversleeping, the sun is trying to wake him up. Are utho baba. So these are two opposite facets of depression. One is patient is not getting depression. The other is, not getting sleep. The other is getting sleeping long, but he's still not fresh when he gets up. Some people used to overeat. Obsessive compulsive disorders. Vague back pain, vague pains and aches. This is another symptom of depression, another facet of depression. And some took to alcohol, some to smoking. Through these caricatures, the medical representative and went, Doctor, what are the various facets of depression? And they used to show these visuals. And the doctors used to laugh. And then it made the job of the medical representative much easier to detail the brand. The brand name was Product. It was the first selective antidepressant, and therefore it did not have any of the side effects of the earlier antidepressants. In terms of efficacy, it matched tricyclic antidepressants. But the biggest advantage which Product had over tricyclic antidepressant, first, did not cause any drowsiness, and second, it was safe even for cardiac patients. There was no problem in the heart when the doctor prescribed Product and could be used safely as adjuvant therapy to the main therapy. You remember what the Ayurvedic doctor said? Firstly, the mind. Treating the mind was through Product. And when the doctors, the non-psychiatrists, they heard about this product and the way it was promoted, they loved it. More important, more than the doctors, the field staff, the medical representatives, they loved this visual aid. अरे डॉक्टर के साथ बात करने में बहुत मजा आता है. And this campaign continued for about 3 years. And ultimately, what happened? In this next segment, cardiology, gastroenterology, consulting physician, this drug was very widely prescribed. Of course, psychiatrists also we promoted it, but the other players were already playing in the red ocean of the psychiatrists. But we got our share from the non-psychiatrists, explaining to them what depression is. And especially, the tagline. What was the tagline? Once a day, breakfast time antidepressant. This was a tagline which was liked by every doctor, every medical representative. All of the antidepressants, they had to be taken at night. But we made a very bold statement through a caricature. See, 8:30 in the morning, the man is having breakfast and having Prodap. So confidently, we told the medical representatives told the doctor, no, doctor, there is no sleepiness at all, no drowsiness at all with Prodap. And this little different type of promotion went to make Prodap the top of the mind brand. It was a top of the mind brand till around 2010. And then things started changing. So once a day, breakfast time antidepressant. This was the tagline which made all the difference. And then we also told the doctor can be safely co-prescribed along with the main drugs in cardiology, in hypertension, in diabetes, in gastroenterology, so that you first treat the mind and then the body. And this made Prodep the brand leader. And then we said the final line was Prodep makes life so normal. And this campaign, which went on for about 3 years or 4 years, made Prodep the brand leader in the antidepressant category and a top of the mind brand amongst the non-psychiatrists.